Have you ever glanced at your fingernails and wondered if they're trying to tell you something more than just your next manicure color? Believe it or not, those tiny ridges, spots, and color shifts could be whispering secrets about your heart's health and, yes, even what's happening down below. Imagine waking up one morning, glancing at your nails and realizing they hold clues to clogged arteries or flagging blood flow to the most sensitive parts of your body. Today, we're diving into how simple nail checks right at your fingertips can uncover critical warning signs of cardiovascular strain and erectile challenges. You won't need fancy equipment or expensive tests, just your eyes, a mirror, and a little know-how. By the end of this video, you'll know exactly what nail changes, demand action, and why ignoring them could put both your ticker and your performance at risk. Stay with me because I'm Dr. Henry, and with over 3 decades of experience in men's health, I've seen firsthand how a subtle nail clue has saved lives and reputations. From pale bluish nails signaling poor circulation to tiny hemorrhages that hint at hidden blood clots, every imperfection tells a story. And when those stories start with your nails, they often end with your most vital organs, your heart, and your manhood. So lean in, inspect those fingertips, and get ready to learn what your nails reveal that your doctor might not tell you until it's too late. Welcome back, gentlemen. In just a moment, you'll discover why the shape, color, and texture of your fingernails aren't just cosmetic quirks. They're a real-time report card on your circulatory system. I'll share true stories of men who caught life-threatening heart issues and creeping erectile dysfunction early simply by noticing changes at their fingertips. We'll break down what pale, blue-tinged, or yellowish nails mean for your arterial health, and how ridges and spots might be a silent cry for help from your penile blood vessels. Plus, you'll hear a quick case study of a 62-year-old patient whose nail exam led to a major heart intervention and a major boost in his bedroom confidence. Stick around for the bonus section, where I'll explain how a clinically studied nitric oxide booster can support healthy blood flow to both your heart and your manhood. That's coming right up after we decode the anatomy of your nails, so keep watching. How your nails tell a story. Before we jump into specific signs, let's understand why your nails are such a powerful health window. Your fingernail isn't just dead keratin, it's anchored to a living bed of cells, blood vessels, and nerves. Underneath the hard nail plate lies the nail bed rich in tiny capillaries that deliver oxygen and nutrients. That small half moon at your nail base, called the lunula, is where new nail cells form, pushing older cells outward as growth. Because nails grow about 3 millimeters a month, they record changes in your body over time, like tree rings hold climate history. When circulation or oxygen levels dip, the nail plate shows it almost instantly. Poor blood flow can turn nails pale or blue, while systemic inflammation or nutrient deficiencies can alter shape and texture. Think of your nails as living radar. The plate's color reflects blood oxygen. A healthy nail bed glows light pink thanks to well-oxygenated blood. If the vessels feeding your heart or penile tissues struggle, they struggle here first. Texture tells a parallel story. Smooth, even surfaces mean balanced cell growth, but ridges, pits, or grooves can signal immune overactivity or hormonal imbalances that impede nitric oxide production. Even the speed of nail growth matters. Slower growth may point to low thyroid function or reduced blood volume. Both can dampen arterial performance. And because your body prioritizes blood for vital organs, any shortage triggers a diversion away from extremities, like nail beds and those sensitive penile tissues. So when you're inspecting your nails, remember you're not just checking for fungal flare-ups or cosmetic flaws. You're reading a daily log of circulatory health, nutritional status, and systemic balance. Over the next few minutes, we'll translate color shifts, shapes, and textures into clear health signals you can act on right now before they evolve into serious heart or erectile concerns. Ready? Let's decode the color clues first and see what your nails are trying to tell your heart and your manhood. Nail color clues for heart health. Let's start with color, arguably the most obvious sign, yet the one most men overlook. Healthy nail beds have a soft pink hue thanks to rich oxygenated blood flowing just beneath the surface. But when that flow falters, your nails can shift through a telltale spectrum. If your nails look unusually pale or almost white, it could mean anemia or reduced red blood cell count, both of which place extra strain on your heart as it works harder to deliver oxygen. Imagine your heart pumping tirelessly, trying to compensate for fewer carriers in the bloodstream. Over time, that overwork raises the risk of arrhythmias and heart failure. A bluish tinge, especially visible at the tip or around the lunula, signals low oxygen saturation. You might assume it's a cold room or poor lighting, but persisting blue nails mean your blood isn't reaching those capillaries with enough oxygen. This condition, called cyanosis, often hints at underlying pulmonary or cardiac issues. Then there's yellowing. While some discoloration comes from harsh chemicals or smoking, persistent yellow nails can indicate chronic heart or lung stress. Thickened yellowish plates suggest long-term circulatory struggles where your vessels may be inflamed or constricted, forcing your heart to push harder to maintain flow. Look for tiny red or brown streaks, splinter hemorrhages running lengthwise under the nail plate. These lines aren't cosmetic, they're microclots tearing through capillaries, a red flag that your blood is prone to clotting. If you ignore them, you risk a bigger clot binding in larger vessels, potentially triggering a heart attack or stroke. On the opposite end, bright white bands or spots known as leukonychia often point to temporary trauma or minor nutrient deficiencies. But when they cover most of the nail, they can signal hypoalbuminemia or low protein levels in your blood conditions that can overload your cardiovascular system. Finally, check for a Terry's nail appearance nails that are mostly white with a narrow pink band at the tip. This pattern has been linked to congestive heart failure and liver disease. When the heart can't pump effectively, fluid backs up into the body and disrupts normal nail bed circulation. In every case, these color changes serve as an early warning system for your most vital organ. All it takes is a glance in the mirror and a moment's attention to potentially uncover serious heart stress before you feel chest pain or shortness of breath. Next, we'll explore how the very shape of your nails can reveal deeper clues about circulation, so keep those fingertips in view. Nail shape and heart risks. Now let's talk shape. Your nail's profile isn't just aesthetic, it's a barometer for your circulatory integrity. First up, clubbing. When the nail tips round and bulb out, creating a shiny convex appearance, it's often a sign of chronic low oxygen levels. Your body responds by growing more tissue at fingertips to compensate, but this change can indicate long-standing heart or lung disease. Next, look for spoon nails or koilonychia. These concave scooped-out plates that hold a drop of water can point to iron deficiency anemia, an issue that forces your heart to work overtime. Without enough iron to produce healthy red blood cells, each beat becomes more labor-intensive, elevating your risk of arrhythmias and heart strain. If your nails curve sharply downward, resembling the shape of a diving board, that's also a red flag. Called pincer nails, this excessive curvature can reflect peripheral vascular constriction, where blood vessels narrow, limiting flow to extremities and putting extra load on the heart. Pay attention to nails that lift away from the bed on onycholysis. Though often linked to trauma or fungal infection, persistent detachment can signal thyroid dysfunction. Since thyroid hormones regulate heart rate and vascular resistance, any imbalance can ripple through your circulatory network, undermining both cardiac performance and penile blood flow. Finally, notice if your nail beds seem unevenly spaced from the plate, forming tiny gaps. This pattern, termed half-and-half nail or Lindsay's nail, shows as a clear band of white near the lunula and a darker band near the tip. It's strongly associated with chronic kidney disease, which often coexists with heart disease thanks to intertwined fluid and pressure regulation pathways. Each of these shape deviations warrants a closer look at your heart health. A quick photo of your nails sent to your doctor could usher in early diagnostics that save your heart from severe damage while preserving the blood flow your manhood needs to thrive. Nail texture and penis health texture might seem subtle, but the surface of your nails can be a hidden billboard for your body's inflammatory and hormonal balance, both of which govern healthy blood flow to your penis. Let's start with pitting. Tiny pits or dents across the nail plate often point to immune system overactivity. Conditions like psoriasis or alopecia are not just skin deep. They trigger systemic inflammation that can interfere with nitric oxide production, the molecule responsible for relaxing blood vessels. Next, examine any horizontal or vertical ridges. Vertical ridges are common with age, but when pronounced, they reveal slowed nail growth, often a consequence of reduced circulation. That same sluggish blood flow can lead to less engorgement during erections. Horizontal ridges, known as Bowes lines, appear after systemic stressors like severe illness or high fever. Each line marks a period when nail growth stalled, periods that may align with episodes of low libido or erectile struggles. Brittle peeling or flaky nails send another warning: you might be missing key nutrients. Biotin, zinc, and essential fatty acids are critical for both nail integrity and endothelial health. When lacking, your penile arteries can develop micro tears, leading to diminished rigidity and endurance. In my practice, I've seen men with chronic brittle nails often report soft or inconsistent erections, only to find that a targeted nutritional regimen restored both nail strength and bedroom performance. Watch for excessive thinning or thickening. Thinning nails can reflect low thyroid function, slowing metabolic processes that support nitric oxide synthesis. Conversely, overly thick nails may indicate fungal invasion, but they can also signal circulatory congestion. When blood pools and circulation slows, the nail matrix compensates by producing distorted, bulky plates, mirroring the same inadequate flow that undermines a firm erection. Finally, don't ignore the tactile feel. Nails that feel tacky or sticky can arise from elevated glucose levels. Diabetes is notorious for damaging small blood vessels, like those feeding the penile tissue, leading to neuropathy and vascular erectile dysfunction. Sticky, sugar-coated nails could be your body's way of pointing to insulin resistance before you even notice other symptoms. By paying attention to these textural cues, you're not just grooming for looks, you're auditing the health of the vessels that fill your penis. In the next section, we'll uncover how specific spots and patches on your nails reveal deeper imbalances, so keep those fingertips in focus. Spots and patches, what they mean. Below the belt, tiny white flecks on your nails, often dismissed as minor trauma, can actually signal more than you think. Known as punctate leukonychia, these spots frequently result from zinc deficiency. Zinc is crucial for testosterone production and nitric oxide synthesis, so low levels can undermine your ability to achieve or maintain a strong erection. Brown or black patches under the nail aren't just cosmetic, they're called melanonychia and can indicate melanin overproduction or, in rare cases, vascular blockages. When you see a dark streak, consider it a red flag. It may mean tiny clots are forming, which not only threaten your heart's arteries, but can also starve the penile tissue of oxygen-rich blood. Next, look for horizontal bands of discoloration, Mises lines. These white bands cross the entire nail and often arise after systemic poisoning or severe infection. If you've ever battled a high fever or heavy metal exposure, these lines may mark the event and point to periods when your penile circulation was compromised. Then there are yellow-brown patches at the base of the nail, sometimes called half and half or Lindsay's nails when combined with a pale upper half. These splits can reflect kidney dysfunction that in turn disrupts hormonal balance and vascular health. Since kidneys regulate fluid and blood pressure, any impairment here can translate into weaker, less reliable erections. Finally, sleepy grayish patches, often seen in smokers, signal carbon monoxide binding to hemoglobin, reducing oxygen delivery. When your blood is compromised before it even hits your fingertips, you can bet it's also struggling to reach your penile arteries. Each spot or patch is like a roadmap of your body's internal state. Ignoring them risks letting small vascular warnings escalate into serious heart issues or persistent erectile problems. In our next segment, we'll dive into how the pattern of ridges, vertical versus horizontal, further decodes your circulation health. So stay tuned. Vertical versus horizontal ridges, circulation signals. Now let's decode the ridges on your nails. Those fine lines that run along the surface, either from cuticle to tip or across the width. Vertical ridges, which appear as parallel lines following nail growth, are common with age. But when they become pronounced or numerous, they reveal a history of reduced blood flow. Think of each ridge as a mile marker on a highway. If traffic is sluggish, those markers multiply. Pronounced vertical ridges can therefore correlate with diminished arterial delivery to both your fingertips and your penile tissues, potentially leading to softer or less sustainable erections. On the other hand, horizontal ridges, known as Bowes lines, cut across the nail like shutter strips. These indicate past interruptions in nail growth, often triggered by systemic stressors, high fevers, serious infections, or major surgeries. Each Bowes line represents a time when your body prioritized essential organs over peripheral tissues, temporarily halting nail production. If you look back at your health history and notice a match, perhaps an illness that coincided with a slump in your libido or difficulty maintaining rigidity, you're seeing the same circulation compromise in both settings. When multiple Bose lines appear across several nails, it could signal recurring stress events or chronic conditions like diabetes, another major culprit in vascular erectile dysfunction. And if you notice that your vertical ridges are deepening while horizontal lines persist, it suggests both chronic low circulation and acute stress hits have been at play, raising the urgency to address any underlying vascular issues. By comparing vertical and horizontal ridge patterns, you get a nuanced picture. Vertical lines speak to long-term flow reduction, while Bose lines chronicle acute setbacks. Together, they map out how your circulatory health has ebbed and flowed, and how those fluctuations affect your heart's well-being and your capacity for strong, lasting erections. Case study: Mr. Nguyen's nail wake-up call. I want to share a story that underscores just how powerful nail observations can be. Meet Mr. Nguyen, a 62-year-old businessman in New York City who prided himself on staying active, cycling to work and evening walks along the river. Yet over several months, his fingernails grew unusually pale and began developing fine vertical ridges. He brushed it off as aging until a routine checkup revealed concerning signs. During a primary care visit, his doctor noticed the nail changes and asked about symptoms. Mr. Nguyen admitted to occasional fatigue and lightheadedness, but no chest pain. Intrigued, his physician ordered a simple blood panel. The results showed mild anemia and slightly elevated cholesterol, early red flags. To be thorough, he referred Mr. Nguyen for a non-invasive cardiac stress test. The stress test revealed reduced blood flow to his left anterior descending artery, often called the widowmaker artery, despite no classic angina symptoms. Thanks to early detection, Mr. Nguyen underwent angioplasty before any serious blockage occurred. His heart function was preserved and he avoided a potential heart attack. But the story didn't end there. After the procedure, Mr. Nguyen noticed something else. His long-ignored difficulty on intimate evenings, once chalked up to stress, had begun improving. His energy returned and the subtle nail ridges started to smooth out within weeks of restoring proper circulation. This case shows that nails aren't just superficial features. They reflect the very blood flow pumping through your arteries and feeding your penile tissues. Had Mr. Nguyen ignored his nails, he might never have discovered silent heart disease until it was too late. Instead, a simple fingertip inspection and a doctor willing to listen saved his heart and revitalized his confidence. So the next time you see pale patches or deep ridges, remember it may be your body's way of tapping you on the shoulder. Don't wait for chest pain or intimacy struggles to become obvious. Act on those nail cues early and you might just save your heart and your manhood from hidden threats. Expert Insight Clip Fingernails offer a non-invasive glimpse into systemic vascular health, explains Dr. Laura Tran, a leading cardiologist with over 20 years of experience. When we see splinter hemorrhages or persistent cyanosis in nail beds, it often coincides with compromised coronary flow, even in patients without chest pain. Similarly, renowned urologist Dr. Michael Pham notes, the microvasculature supplying the penile tissue is extremely sensitive to changes in blood composition and pressure. Nail abnormalities such as Bose lines or pronounced vertical ridges can mirror what's happening in those tiny erectile arteries. Together, these expert voices confirm that nail diagnostics aren't just folklore, they're rooted in real clinical correlations. Next, we'll dive into a game-changing nutritional support that leverages these insights to boost blood flow where you need it most. Your secret weapon for circulation and vitality. Let's talk about how you can actively support the blood flow you've just decoded at your fingertips. Introducing Nitric Boost. This clinically studied powder is designed to amplify your body's natural nitric oxide production, the molecule that relaxes and widens blood vessels, ensuring robust circulation to both your heart and your most sensitive areas. When you mix Nitric Boost into water each morning, its proprietary blend of L-arginine beetroot extract and key cofactors works synergistically. L-arginine serves as the direct precursor for nitric oxide synthesis, while beetroot provides dietary nitrates that convert into NO through alternate pathways. The cofactors vitamin C and folate stabilize and extend the lifespan of nitric oxide once it's produced, maximizing its vasodilating effects. Imagine your arterial pathways as garden hoses. Over time, those hoses can stiffen, kink, or narrow, restricting flow. Nitric Boost acts like a high-grade hose conditioner, nudging vessel walls to relax, smooth out, and carry more blood with less pressure. This not only reduces the workload on your heart, potentially lowering blood pressure and improving cardiac output, but also enhances engorgement in penile tissues, translating into firmer, longer-lasting erections. Clinical trials have shown that daily supplementation with similar NO support formulas can increase blood flow velocity by up to 25% within weeks. In one study, men reported significant improvements in erection rigidity and duration after 8 weeks of consistent use. Another trial noted better exercise tolerance and reduced angina frequency in patients with mild coronary artery disease. Now here's a real-world testimonial. I started noticing my nails regained their healthy pink color within 2 weeks of using Nitric Boost, says one user in his mid-60s. By month's end, not only did my circulation feel stronger during workouts, but my intimate life saw a dramatic turnaround. Hardness, stamina, everything improved. That transformation mirrors what we aim for, restoring optimal blood flow from your heart to every extremity, including your penile microvasculature. The beauty of Nitric Boost lies in its simplicity. No prescriptions, no injections, just a daily stir of powder into water or your favorite smoothie. Its blend is vegan-friendly, free of artificial flavors, and backed by quality testing to ensure purity. And because it taps into your body's own nitric oxide pathways, it complements other lifestyle measures like balanced nutrition, hydration, and moderate exercise, rather than replacing them. So when you inspect your nails and notice those subtle signs of circulatory compromise, think of Nitric Boost as your ally. By targeting the root mechanism, nitric oxide production, you're proactively supporting vessel health in a way that shows up in your nail beds, your cardiac function, and your performance in the bedroom. Before we move on to daily nail care tips, remember proactive circulation support is the key. With Nitric Boost in your routine, you're not only decoding the signals your body sends, you're answering them with a solution that restores vitality, confidence, and overall vascular wellness. Daily nail and circulation care tips. To keep your nails and your vascular system in top shape, start with hydration. Drinking adequate water ensures blood stays fluid, reducing the risk of microclots that show up as splinter hemorrhages. Next, focus on nutrition. Biotin-rich foods like eggs and nuts support nail matrix health, while iron sources, spinach, lean meats keep anemia at bay, preventing pale, brittle plates. Don't forget zinc, pumpkin seeds, and shellfish help maintain testosterone levels and nitric oxide pathways, crucial for strong erections. Incorporate antioxidant-packed berries and leafy greens to combat inflammation, smoothing ridges and reducing Bowes lines. Beets or beetroot powder twice a week can boost dietary nitrates, complementing any supplemental nitric oxide support you choose. Make a habit of a weekly mirror check. Sit in good light, inspect each nail for new spots, shifts in color, or emerging ridges. Keep a photo log on your phone compared side by side. You'll catch subtle trends before they escalate. Trim and file nails straight across to prevent onycholysis and pincer nail formation. Use a gentle nail brush to clean beneath the plate, avoiding harsh chemicals that yellow and weaken keratin. Finally, move your body. Even a daily 20-minute brisk walk promotes endothelial function, delivering oxygen-rich blood to extremities and penile tissues alike. If sitting at a desk all day, stand and stretch every hour to maintain circulation. By weaving these simple habits into your routine, you're not just grooming, you're safeguarding the very vessels that keep your heart strong and your performance reliable. Viewer engagement challenge. Here's a challenge for you. Grab a mirror or your phone's camera and take a close-up look at your fingernails right now. Do you see any pale patches, ridges, or tiny spots? Snap a quick photo and drop it in the comments. Let's decode them together. Tell me which nail caught your eye and why. Was it the thumb that looked a bit bluish, or those fine vertical ridges on your ring finger? Share what you notice, and I'll highlight the most common patterns in our next video. Bonus points if you include how long you've observed that change, whether it popped up overnight or has been creeping in over months. Your single nail photo could reveal a hidden clue about your heart health or erectile stamina and help our whole community learn to spot trouble early. Ready, inspect those fingertips, comment below with your findings, and stay tuned, because in our next episode, we'll review your real-life nail photos and uncover what they mean for your vascular wellness. Summary of key takeaways. You've now learned to read your nails like a health report, color signals. Pale or white nails can hint at anemia, bluish tints warn of low oxygen, and yellowing suggests chronic strain on your circulation. Splinter hemorrhages reveal microclot risks, while Terry's nails point to possible heart failure. Shape alerts clubbing indicates long-term low oxygen spoon nails, flag iron deficiency, and pincer nails show vessel constriction. Onycholysis and Lindsay's nails can signal thyroid or kidney disturbances that ripple into cardiac and penile blood flow. Texture clues, pitting and ridges mark inflammation or slowed growth, both tied to reduced nitric oxide. Brittle flaky plates mean nutrient gaps, and sticky or overly thick nails can point to diabetes or circulatory congestion. Spots and patches, white flecks often mean zinc shortfalls. Brown streaks warn of clotting, and mise lines and gray patches trace past systemic stressors and oxygen deprivation. Ridge patterns, vertical lines map chronic flow reduction, while Bowes lines chronicle acute stress episodes that likely impacted both your heart and erectile function. By combining these observations, you can detect silent vascular issues long before chest pain or performance problems arise. Remember Mr. Nguyen's story how pale nails and fine ridges led to life-saving cardiac intervention and restored intimacy. And keep in mind, the experts' consensus nail diagnostics offer a low-cost, non-invasive window into your cardiovascular and penile health. Thanks for joining me on this deep dive into the hidden messages your fingernails are sending about your heart and penile health. If you found these insights valuable, hit that like button and subscribe so you won't miss our upcoming deep dive videos like next week's Toenail Secrets for Prostate Health. Curious to start supporting your circulation today? Check the link in the description for Nitric Boost, a simple daily powder that helps kickstart nitric oxide production for better blood flow from your heart all the way down to your most sensitive areas. Don't forget to share this video with a friend or family member who might benefit from a mirror check right now. And drop your nail photos or observations in the comments. Let's keep decoding these signals together. I'm Dr. Henry, reminding you that health clues are often closer than you think sometimes, right at your fingertips. See you in the next video.